Hello, my name is Katie Weber with the Indiana Complex Care Coordination Collaborative at Indiana University School of Medicine. I am here to talk to you about checking in for an appointment at the doctor's office. Each doctor's office may have its own way to remind you about a visit. You may receive a text or phone call or portal message a few days ahead of time. Make sure the appointment is on your calendar. Check that you have transportation. Put your identification, insurance card, list of medicines, and list of questions or problems you want to talk about in a place that will help you remember to bring them to the appointment. Sometimes you have to wait at the doctor's office. It is also a good idea to bring things to do while you wait. You will need the right information to check in or register. Remember to bring your identification, insurance card, and list of medicines. You will be asked to repeat your address, phone number, and email. You will be asked about your health insurance. If it is hard for you to do this, you may want to bring this information written out on a piece of paper. Some offices let you check in online using your computer or smartphone. Some offices have a computer in their lobby for you to check in. You can always ask for help from a person if you need it. Most offices ask you to arrive for the appointment 15 minutes before the time it is scheduled. This lets you have time to check in and get ready to see the doctor. When you get there, a receptionist will greet you at the front desk. They will ask your name and why you are there. Tell them your first and last name and which doctor you will see. They may also ask your date of birth. Then, the receptionist may ask you to show your ID and insurance card. Sometimes, they need to take the cards to make a copy of them and then give them back to you. They will give you papers to read and fill out. If you are over 18 and you make your own health decisions, you will be given a consent form. This form asks you to sign your name to agree to 4 main things. 1. You agree to talk to the doctor and let him or her examine you. 2. You agree to the rules of privacy where the doctor promises to keep your information private. 3. You agree to let your insurance be billed for the visit. And 4. You understand that if your insurance doesn't accept the bill, you may get a bill. It is very important that you never sign your name on a contract or consent if you do not understand what is written on the page. Ask for help if you need it. You can also ask if they have an easy-read version of the form. The receptionist may also ask you to fill out a form. It may ask what you are coming in for, your medicines, and your medical history. If you have a prepared form with you, ask if you can use it instead. Ask for help if you need it. Include your decision-making supporter. If you are your own decision-maker, you may bring anyone you want with you to the visit to help. If you have a person who helps you with medical decisions, you can bring them to your visit. If they cannot come with you, you may also want to call them on the phone so they can be part of the visit by phone. Different types of helpers are a guardian, a healthcare representative or power of attorney, or a supported decision maker. If you have legal papers that show these agreements, make sure that your doctor's office has a copy to keep in their records. If you do not have legal papers, write the name of your supporters on the communication consent form. Some insurance plans have a copay for doctor's visits. If you do not have insurance, you will have to pay yourself. It is a good idea for you to know about this ahead of time. Most offices take cash or a payment card. If your insurance is Indiana Medicaid disability, most patients will not need to pay anything. Once you finish your check-in, the receptionist may ask you to wait in the waiting room. You can ask how long you may need to wait. If you are not comfortable waiting in the waiting room, you can ask to wait outside or in your car. Make sure they have a phone number to call you when you need to come back inside. You can also ask if there is a quieter place, like an exam room, where you can wait. That is the office check-in. Thank you for watching. I hope this video helps you feel ready to go to an appointment at your doctor's office. For more videos and other ideas for being healthy, please visit our website forourhealth.org.